Hello students, welcome to EPG Pathshala. I am Dr. Renu Tyagi from Sardar Patel Institute, Ahmedabad. Today we will study the module titled Hemodynamics and Exercise under the paper Physiology and Sports Anthropology. So students, let's see what we are going to learn from this module. From this module, we'll try and understand the blood flow during the rest and during the exercise. Then we'll study various biological parameters which affect the blood flow in our body. Then we'll try and understand the physiological factors which regulate the blood flow during exercise in our body. In the previous chapter, we have discussed the basic structure and function of our circulatory system as a prelude to the cardiovascular performance. Now, we'll comprehend the physiology of cardiovascular system which regulates the flow of blood in the body during rest as well as during the exercise. The understanding of the physical law that governs the blood circulation in our body is known as the hemodynamics. Now, what do we understand by the hemodynamics, or how does it is affected in our body? Some of the major hemodynamic factors considered in this particular module are blood pressure and number 2, vascular resistance or total peripheral resistance to the blood flow. In other words, the hemodynamics relate to the study of relationship among blood pressure, viscosity resistance to the flow and the volume flow rate in the cardiovascular system. We can see a picture of hemodynamic factors here. As we can see, the most important among the hemodynamic factors is the blood pressure. Now let's see what the blood pressure is. With each contraction, that is a systolic phase, blood pumped from the left ventricle distends the aorta and creates pressure within it. And this pressure is known as the systolic blood pressure. It reflects the force exerted by blood against the arterial walls. Subsequently, during relaxation phase, that is the diastolic phase, natural elastic recoil of aorta wall propagates the pressure as a wave through entire arterial system until the next surge from ventricular systole. The pressure in the arteries during this relaxation phase is known as the diastolic blood pressure. This indicates the resistance exerted as the blood flows from arterioles to the capillaries. One can easily feel the pressure as pulse at superficial radial artery on the thumb side of wrist, temporal artery on the temple side of the head, carotid artery along the side of the trachea. Let's elaborate some more on the blood pressure. The arterial blood pressure reflects the combined effect of arterial blood flow per minute, that is the cardiac output, and resistance to that flow in peripheral vasculature. This can be mathematically expressed as the cardiac output multiplied by the total peripheral resistance. Similarly, the cardiac output can be represented as the product of stroke volume and the heart rate. An increase in the stroke volume and heart rate would consequently generate more cardiac output, while a decrease in any of these parameters would decrease the cardiac output. With an enhanced cardiac output, there would be an increase in blood pressure. The blood flow through the vascular circuit is generally determined by the laws of hydrodynamics applied to rigid and cylindrical vessel. It relates to two things. Number one, directly to the pressure gradient between the two ends of the vessels rather than absolute pressure within the vessel. And number two, it's inversely related to the resistance imposed to fluid flow. So mathematically, we can express the blood flow as the ratio of pressure gradient to the total peripheral resistance. Now let's see what is pressure gradient. The blood flows through the vessels of circulatory system as a consequence of pressure gradient, that is from the higher pressure to the lower pressure area. For instance, during systole, that is the contraction of heart, left ventricle has the highest pressure while the right atrium has the lowest pressure, which drives the blood to flow throughout the systemic circulation. Compared with the aorta, the pressure in large and medium-sized arteries falls only slightly, while rapidly in small arteries and arterioles. The pressure continues to decline through capillary and venous system. Similarly, for pulmonary circulation, right ventricle has higher pressure than the left atrium. We have understood that the blood flow is the pressure gradient divided by the total peripheral resistance. Now, let's understand the concept of total peripheral resistance. What does it mean to us? The factors which determine the resistance to our blood flow are the blood, that is the thickness or viscosity of the blood. Number two, it is influenced by the length of our blood vessels. And number three is the radius of the blood vessels, that is how wider is the blood vessel. Mathematically, Poiseuille's law relates the total peripheral resistance TPR to the blood viscosity V and the blood vessel length L to the blood vessel radius R, 4, as the formula speaks like that TPR, that is total peripheral resistance, is equal to L into V, that is length of the blood vessels, into the viscosity of the blood divided by the radius R to the power 4, where R is the radius of the blood vessels. Now earlier we studied that blood flow is equal to pressure gradient divided by the total peripheral resistance, and now we understood the total peripheral resistance is equal to the length into the viscosity divided by the radii. Now combining these two equations, we can come to the conclusion that the blood flow is equal to the pressure gradient multiplied by R raised to power 4 divided by L plus V. So from these relationship between the total peripheral resistance and the pressure gradient, which helps us to find out or decide the speed of blood flow in our body, it could be very well interpreted that more viscous is the blood, greater is the resistance offered to the flow, as well as longer is the blood vessel, greater is the resistance to the flow. Since blood viscosity and the length of the blood vessels in the body remains relatively constant, the leading factor or the deciding factors which affects the blood flow is the radius of the vessel. Further, the resistance to the blood flow is inversely related to the fourth power of the blood vessel radius, which signifies that the change in the blood vessel radius would lead to disproportionate increase or decrease in resistance and consequently to the blood flow. For instance, if we reduce the blood vessel radius to half, the blood flow declines by 16 units. Conversely, doubling the diameter of the blood vessel would increase the blood flow to 16 times. This indicates that even smaller degree of the vasodilation or vasoconstriction of our blood vessels could alter the regional blood flow in our body. Let's see the factors which control the muscle blood flow during the exercise. During exercise, many of the capillaries in the muscles open up to meet the demand of local tissues for oxygen and nutrients, which otherwise remains closed. The ability of capillaries to open and close in response to the physiological demands has been referred as autoregulation, and it could be extrinsic or intrinsic, as can be seen from this picture. The extrinsic regulation refers to the neural and endocrine factors. Now let's see what is the extrinsic regulation in detail. A nervous regulation of blood flow to skeletal muscle is under the influence of the sympathetic nervous system. There are two types of nerve fibers which infiltrate the muscular layer of blood vessels. Number one, that is the cholinergic vasodilators fibers release acetylcholine, which increase the blood flow through vasodilation. And number two, adrenergic vasoconstrictor fibers release norepinephrine, which restricts blood flow in inactive areas through vasoconstriction. Continual sympathetic neural constriction activity maintain a relative state of vasoconstriction known as vasomotor tone. Furthermore, activation of sympathetic nervous system cause adrenal gland to release epinephrine and norepinephrine hormones into the circulatory system. These hormones increase the heart rate and force of ventricular contraction or the stroke volume while performing the exercise. Consequently, epinephrine reduce the blood flow to non-exercising muscles and organs such as intestine and kidney via constriction of peripheral blood vessels, while epinephrine maximizes the blood flow to the working muscles via vasodilation. Now let's come to the intrinsic regulation, which refers to the control by the conditions in the local vicinity. With exercise, there is an increase in body's metabolic products such as carbon dioxide, acidity, adenosine, nitric oxide, magnesium, and potassium ions as a consequence of elevated tissue metabolism and increased oxygen need. These accumulated metabolites stimulate vasodilation of blood vessels in active muscles, thereby reducing the vascular resistance to increased blood flow. The metabolic vasodilation of capillaries in active muscles occurs soon after the onset of exercise. Let's see an influence of exercise on our blood pressure. First, look at the change in blood pressure or the blood pressure at rest. In a healthy individual, arterial pressure reaches 120 mmHg during cardiac systole, while 70 to 80 mmHg when heart is in diastolic phase. Mean arterial blood pressure, that is MAP, represents the average force exerted by the blood against the arterial walls during a cardiac cycle. It ensures an adequate perfusion through the vital organs of the body. It can be considered pioneer among hemodynamic factors, can be estimated as the diastolic blood pressure plus 0.333 and a difference of systolic to diastolic blood pressure. Now let's come the change in the blood pressure during the exercise. The exercise can be a steady rate exercise, it can be a resistance exercise, or it can be a graded exercise. So blood pressure during a steady rate exercise or during the rhythmic muscular contraction activities like the brisk walking, jogging, swimming, cycling and hiking, dilation of active muscles, blood vessels, increase the vascular area for blood flow and thereby reduce the peripheral resistance. An increased blood flow during such exercises increase the systolic blood pressure in the beginning and then reaches a plateaus between 140 to 160 mmHg in a healthy sedentary individual. While among trained athletes with endurance, the systolic blood pressure may increase to 200 mmHg because of large cardiac output among them. Diastolic blood pressure, however, remains relatively unchanged throughout such exercise. Now let's come to the resistance exercise. During this training exercise such as shoveling, sustained muscular force compresses the arteriole supplying blood, which considerably increase the resistance to blood flow. Consequently, there is dramatic increase in blood pressure. To restore the blood flow, cardiac output and mean arterial blood pressure increases substantially. Now let's come to the third grade of exercise, that is a graded exercise. During continuous graded treadmill exercise, there is rapid increase in blood pressure initially. Later, systolic blood pressure increase linearly with exercise intensity, while diastolic blood pressure either remains same or may decline in case of high intensity exercise. The systolic blood pressure may go up to 200 mmHg among healthy men and women during maximum exercise despite reduced peripheral resistance. This could be attributed to larger cardiac output among these individuals. Now let's see the blood pressure during the recovery. After a period of light to moderate intensity exercise, systolic blood pressure decreased temporarily below pre-exercise level for up to 12 hours in normotensive and hypertensive individual. And this could be explained by significant amount of blood being pooled in our visceral organs and limbs during the recovery. Relatively prolonged reduction in post-exercise blood pressure, known as hypotensive recovery response, justifies recommending exercise as non-pharmacological therapy for the hypertension. Let's have a look at various physiological factors which affect our blood pressure. The broad factors can be classified as age, the sex, the effect of meal, our emotions, our posture, and body composition of an individual. Let's take age first. In a healthy individual, the blood pressure tends to increase with age. The normal range of blood pressure is 120 by 80 mmHg, while value above 140 by 90 mmHg are considered to be high as per the JNC or Joint National Committee's standard. High blood pressure damages endothelial lining of blood vessels and leads to the development of cardiovascular diseases. It is to be noted that values above 140 mmHg do not necessarily indicate abnormal state of high blood pressure. For some individual, the abnormal value may be physiological normal. In fact, in older people, systolic blood pressure of 160 to 170 mmHg are considered to be normal. An increase in blood pressure with age is due to the stiffening of our blood vessels. Now let's see an influence of gender on our blood pressure. The male generally have higher blood pressure than females of similar age. However, after menopause, the blood pressure tend to increase by 4 to 6 mmHg among females than that of their age-matched males. This could be attributed to the reduced level of the hormone estrogen after the menopause, which has a protective effect against the blood pressure. Let's see an effect of meal on our blood pressure. Systolic blood pressure increases by 4 to 6 mmHg after a meal, and it's sustained for about 1 hour, while diastolic blood pressure either remains same or declines slightly due to vasodilation of blood vessels, supplying blood to organs in our abdomen. Hence, it is suggested not to measure the blood pressure until 1 hour after our meal. Let's see the emotions impact on our blood pressure. The emotional states such as excitement, anxiety, and fear increase the arterial blood pressure due to an increase in sympathetic activities. A slightest emotional involvement may increase the blood pressure significantly. During emotional stress, sympathetic neural impulse originating from cerebral cortex stimulates medullary centers to release the stress hormones, that is adrenaline and cortisol, into our blood. These hormones regulate fight or flight response by increasing the heartbeat and constricting the blood vessels, which enables flow of blood from extremities of the body to the core. These physiological changes lead to temporary increase in blood pressure, which declines as stress goes away and blood pressure returns to the pre-stress level. Our posture also has an impact on our blood pressure. When a reclining subject stand up, the pressure in the vessels below heart level increase, and in the vessel above heart level decrease due to the hydrostatic or gravitational force. Peripheral pooling of the blood leads to decreased venous return and cardiac output. Consequently, there is momentarily decrease in systolic blood pressure. A fall in systolic blood pressure inhibits the baroreceptors and stimulates sympathetic neural activities, leading to an increase in diastolic blood pressure up to 10 to 15 mmHg. Now, in the last, let's see an impact of body composition on our blood pressure. As individuals with body fat above normal range are at an increased risk of higher blood pressure as compared to the normal weight thin individual. Among these individuals, deposition of cholesterol in blood vessels lead to increased stiffness and narrows in vascular diameter, which increases the blood pressure. Let's have a look how we can measure our blood pressure. There are two ways of measuring the blood pressure, that is a direct method and an indirect method, which can be seen in this pictorial representation. The blood pressure can be measured directly with a fluid-filled catheter and transducer. A thin catheter is inserted in the artery of an individual and the readings are recorded through transducer. However, this technique is invasive and mostly used in the clinical settings, which can be seen on the left-hand side of the picture. Hence, indirect measurement based on the auscultation method, that is listening to sounds, is more frequently used, being more practical. This is the most commonly used in the field conditions. This technique was described by Russian vascular surgeon Nikolai Korotkov in 1902. This technique requires a stethoscope and sphygmomanometer consisting of a blood pressure cuff and an aneroid or mercury column pressure gauge. The standard procedure for recording the blood pressure is as follows. A typical measurement sequence occurs as follows. as per the Pickering et al. Standards. The patient need to be seated comfortably with the back supported and the upper arm supported at heart level. The cuff should encircle the upper arm circumference approximately 1 inch above the bend in the elbow. Appropriate sized cuff should be used for children, adults, and obese person. The stethoscope should be placed lightly over the brachial artery in the cubital fossa. The cuff should be rapidly inflated to a pressure of about 130 to 150 mmHg. The mercury column then should be allowed to fall at the rate of approximately 2 mmHg per second. The very first audible sound, known as the corot cough, should be recorded as the systolic blood pressure, and the last sound should be recorded as the diastolic blood pressure measurement. The mercury column should be read to the nearest 2 mmHg. Neither the patient nor the observer should talk during the measurement. So, students, let's summarize what we have learnt in this module till now. We know the blood flow is there in our body, and there are various parameters which influence this blood flow control in our body. We have studied so far that in response to the exercises, our cardiovascular system undergo various changes in order to meet the enhanced physiological requirement, which is partly accompanied by an increase in blood flow to the active muscles. The hemodynamic law we have understood so far suggests us that the flow of blood through the circulatory system in our body is directly proportional to the pressure gradient or the pressure difference and the radius of the vasculature, that is the radius of the blood vessels. As there is a wider blood vessel, the blood flow accordingly increase, and if there is a more pressure gradient, the blood flow will increase, while this blood flow is inversely proportional to the length of our blood vessels and the thickness of our blood, which means that thicker is the blood, the slower is the rate of blood flow in our body, or the more is the length, the slower is the flow of the blood flow in our body. These factors integrate with the neural and hormonal changes to enhance the physiological response in an normal healthy individual. Blood pressure is often influenced by the age of an individual. We have studied that it varies among the young group to the elderly group. The elder people generally tend to have little higher blood pressure, and it is influenced by the gender of an individual. Generally, the females tend to have a lower blood pressure of the similar age group males. Similarly, the blood pressure is greatly controlled by the posture also. While we are in supine position, it's different, and while we are in a sitting upright position, the blood pressure is different. Similarly, our blood pressure is greatly controlled by the kind of meal we take. Depends the frequency of our meals and the type of meal we take. And then next we studied that emotions or the emotional status of an individual also influence our blood pressure. And body composition, which is considered to be a great factor nowadays, influence the blood pressure to a great extent. We have studied the different people, like the people who have the higher body weight generally tend to have a higher blood pressure, and the people who are underweight have a lower blood pressure as compared to the obese or the people with the higher body fat. So these are the various parameters which influence the physiological parameters, that is the blood pressure. Thank you.